afternoon, and thank you for joining us. My name is Dr. Joan Reed. I'm Dean for Diversity and Community Partnership at Harvard Medical School. There are over 700 registrants joining us for today for our discussion on applying to medical school during COVID-19, including students from and their families, faculty, administrators across many schools and community organizations. Today's webinar is sponsored by the Harvard Medical School Office for Diversity, Inclusion, and Community Partnership. The mission of DICP is to advance diversity and inclusion in health, biomedical, behavioral, and STEM fields in ways that build individual and institutional capacity to achieve excellence, foster innovation, and ensure equity in health locally, nationally, and globally. DICP efforts support the career development of junior faculty, trainees, and students, identify and train leaders in academic medicine and health policy, and provide programs that address crucial pipeline issues. A few housekeeping notes as we begin today's session. Chat will not be available, and your microphones will be muted. You can use the Q&A to post questions to panelists, and this webinar is being recorded and will be posted on the DICP website. It's now my pleasure to introduce Dr. Alden Landry. Dr. Landry is an emergency medicine physician at Beth Israel Deaconess Medical Center and is the founder of Motivating Pathways, Inc. He's assistant professor of emergency medicine at Harvard Medical School and assistant dean of the Office for Diversity, Inclusion, and Community Partnership at Harvard Medical School. And now I'd like to turn this over to Dr. Landry.
Thank you, Dr. Reed, for the introduction, and thank you for your leadership as a part of the Office for Diversity, Inclusion, and Community Partnership at Harvard Medical School. I want to welcome everybody to this panel. I'm very excited for us to be in this room together, to have this conversation, and to be in the space where we can talk about the application process to medical school. Part of the impetus for this conversation was that we have seen that data is showing that there are more students applying to medical school this year compared to prior. We think a lot of it has to do with the impact of COVID-19, but also a genuine interest in pursuing a career in the health professions. Additionally, we have students who are earlier on in their pathway who are considering a career for medicine, but what they've experienced over the past year and seen our country go through in the form of this pandemic has encouraged them to pursue a career in the health professions. And so we're excited to be in this space to have this conversation and to help you all to think about what are the important parts that you need to be thinking about as you craft your application for medical school, as you put together the pieces of your application, some of which used to be traditional and fairly straightforward and easy to do, but now is a little bit more complicated due to the limitations that we have with COVID-19. With that, we have an excellent group of panelists who are joining us today who are going to help us as a part of this conversation, and I'd love to introduce them before we get started with the conversation. First, I'd like to introduce Mr. Francisco Castelan. He's the Assistant Director of Pre-Health Advising at Georgia Institute of Technology. Next, I'd like to introduce Dr. Christopher Lathan, who is the Director for Cancer Care Equity at Dana-Farber Cancer Institute. He's also an Assistant Professor of Medicine at Harvard Medical School. Next is Ms. Janae Lawler, who is the Director of Academic Advising and Strategic Initiatives at Michigan State University College of Natural Sciences. And last, Dr. Sunny Nakae, who is a Senior Associate Dean for Equity, Inclusion, Diversity, and Partnership, and an Associate Professor of Medical Education at California University of Science and Medicine. Next slide. We're going to do a roundabout series of questions, and we're going to try and answer as many questions as possible. As Dr. Reed mentioned, the chat is closed, but we do have the Q&A function open. So if you have questions, feel free to drop those in the chat. I'm willing to bet that our panelists are going to be really encompassing in this conversation that we're going to have over the next hour and a half, and are likely to going to cover everything that you were thinking of. But if you have other questions, feel free to put those questions in the Q&A, and we'll try and get to those as many as possible. But I want to go to you, Janae, first. You're a pre-health advisor, and you've experienced the COVID-19 pandemic from a number of perspectives. How has it impacted students, and how, in thinking about this experience, and the recent data from the AAMC, as I was mentioning earlier, saying that more students are applying to medical school. How are you advising students to approach this application season to ensure that their application stands out?
Yeah, sure. So the pandemic has impacted people, and everyone has been impacted, but just how everyone has been impacted is different. Everyone doesn't have the same support systems or the same methods of dealing with trauma. And so it is different for everyone. There is no cut and dry, oh, we're all just suffering because of the pandemic. Everyone has a different level of what they can handle and what they have access to be able to handle successfully. So that's something that I keep in mind when I am working with all students. It's not just a black and white or cut and dry or cookie cutter answer for how to have your application stand out, because there's a lot more nuances that have to be considered when you are talking with a student about how best to promote themselves and how to tackle the current situation with the pandemic and how it's impacted them in a way that feels genuine, but also has the student in mind and their best interest in mind. Some of the things that I have always told students still ring true now. It's not what you did, it's why you did it. Everyone is doing the same things, even now. Everyone has lost a lot of access, all the pre-health students. I mean, have lost a lot of access to some of those things that they used to have, being able to shadow, easy access to volunteer in clinical settings and things like that. So everyone lost that pretty much at the same time. And so it is a time to really help students to think more critically about the things that they're bringing to the table, their skill sets and things like that, and really to help them realize the importance of strategizing their application. So applying to med school is a team sport. It's not something you do on your own. I'm the only one that writes my personal statement and I have to fill in everything. Yes, but you should be creating a team to help back you up and to help you throughout this process. A part of that comes with identifying your letter writers. And one of the things that I stress with students is you need to have an actual concrete reason why you are asking specific people to write letters for you. What is this person going to talk about that's not someplace else in your application? And that means you need to have looked at what is necessary for the application. So read it over, looked over all of the information that they want so that you can have letter writers that can confirm the things that you're saying and also give a little bit more. So having letter writers that know something about you and having that conversation with them prior to them writing the letter, because you don't get to see the letter, kind of helps you to strategize where you're going to have pockets of information. Who's going to talk about my volunteer experience and my leadership versus who's going to talk about my research experience, all the different hats that I wear, and how am I going to get them all on this application? So make sure that you're exploring the primary application and all the information that is needed, and you're not just asking for letters haphazardly, just whoever will write me because I need 2 science letters. No, you want to be a lot more intentional about that because you want to be able to show all the different pieces of who you are. Understanding that the schools already know you're good at school. They know you understand science and they know you know how to handle a standardized test, which that's what your GPA and your scores are for. So a letter writer that is just going to talk about your grade in a class is not helpful. And AAMC actually has a really good guide that I direct students to about the competencies that they want students entering medical school to have. And that is a really good way. You can download the PDF of the AAMC website. It's a really good way to start that conversation about how to ask your letter writers to write you a letter and why you're asking them and what you want them to write about, so that you have some direction and at least some type of understanding of what they may talk about so that you can strategize a little bit better. There's also a part if you're applying to MD school and AMCAS where you are offered the opportunity to designate some of your activities as your most meaningful experiences. This is not a requirement. Yes, it is. You absolutely need to be using that because it gives you additional characters to be able to, spaces to be able to talk about things that can come out of your personal statement so that you have more room to talk about other things in your personal statement. And a lot of students really ask, do I really need to do that? Yes, and you should be doing this outside of just the pandemic impacting you. If you don't have 3 meaningful experiences, it may be time to, excuse me, you do. All of you have 3 meaningful experiences if you'll act time. If you can't identify and articulate them, it might be time to just have a sit down and some thoughts and write down some journaling or something so that you can get those together and identify those so that you can write about them, because you should be able to have 3 experiences that were meaningful to you out of all the things that you've done. You need to have friends and family and strangers as a part of your team. And I say strangers because that is exactly what the admissions committee is. There are people that don't know you that are just reading words on the application, and that is what they know of you. So you need to have people that don't know you as well reading your information to tell you whether or not the message that you're trying to get across is coming across correctly. So not, can you just tell me whether or not this is grammatically correct or does this sound good? Ask them, what did you take out of this personal statement? Or what did you take out of this, so that you can make sure that what you are intending the admissions committee to know about you and take out as important is actually what's coming across. And that the tone that you're trying to use at different parts is what you want to come across. So definitely important to have people that don't know you as well reading over your things, because that is what the admissions committee is going to be.
Thank you, Janae. It's very interesting as I hear you as a pre-health advisor and have known you for a number of years. It's great to see that you still sort of stick to your advising compass and know your true north in the way that you direct students. You mentioned a question about, or you mentioned about having those meaningful experiences, and that's something that students are maybe a little bit struggling as they think about right now. And some students are concerned about getting those experiences as a part of their application, specifically thinking about shadowing and research. And how are you advising students in this time when opportunities are really limited?
Yeah, so this is your time to shine. This is the time where you can really break out of the I'm just checking off boxes mode that all of your advisors are always telling you to do anyway. Get out of the checkbox. You really get to do this now because the pandemic upended everything. So you need to be able to showcase your abilities outside of just the quote unquote, I want to help people, so I'm going to go into some type of healthcare setting. If your intention in terms of becoming a health professional of any kind is just based off of you being able to volunteer or do community service in some health related area, that's not really community service. That's you learning more about the field that you want to go into, and you just happen to be helping other people. You want to be doing things where the full intention is just to help other people. And the one thing that the pandemic did is give lots of opportunity to help other people. Everyone needs help right now. And it's the time for you to be able to show those transferable skills and show some real true leadership experience. If you are good at math, there's someone that needs help with taxes right now. You may be able to help some low-income families with tax preparation, especially since so many things are changing with how you can do taxes and unemployment coming into play and things like that. If you have extra time because all of your classes are asynchronous and online, there's some food banks, there's community centers, there's churches, nonprofits, all of these places that are in need of some extra dedicated, dependable, responsible hands to try to help their communities. And because of the situation that we're in, a lot of them don't have a whole lot of money to be paying positions for this. They need volunteers. They just need consistent, dedicated volunteers. And those are areas where you can really donate some time to help the community around you, because this is a rallying time for everyone to dig deep and help your fellow community members. If you like being social, organize some video chats for those that are in retirement communities or retirement homes, those populations that really feel isolated and forgotten because you haven't been able to go and socialize as much as possible. They can't see their family can't visit because they are high risk and things like that. There are things that you can really think through and use your expertise as a young person to really help and benefit the community around you. Other things you could do just for your school. All of you next year, starting in fall, are going to have a swath of rising sophomores that probably have not experienced campus if your campus shut down and everything is remote, or not the real campus feel. You've been at school for a year or two, you know what the real school feels like. And the freshmen from last year, they don't know that. And the incoming freshmen for fall 2021, they're coming off of a high school year where they were mostly isolated. They didn't get to have the senior year that everyone experienced from high school. What can you be doing to help that community acclimate to the culture of your campus? What things can you do to help them? Does your school have a bereavement policy? Because there's a lot of grief across the world right now. Does your school have one? Can you help with creating one or start the process for that? So there are ways that you can showcase leadership experience and your ability to think outside the box and be able to use those transferable skills on your application and show these are things that I could do that were in my purview during the time of a pandemic. And so I utilized that and did the best I could, even though I could not get into a shadowing situation in person. There's virtual shadowing and things like that you can do, but this is also a great time to be able to show I'm here to help people for real, not just help people as long as it helps me get into med school.
Thank you for that, Janae. And it's interesting, you always talk about transferable skills and how people can take their experiences in one places and use that elsewhere. And it's something that we have to think about critically in this time. When we can't do the traditional things that pre-meds would do, which is being in the lab, being, doing bench research, especially if there's restrictions at the universities related to COVID, or being in the hospital, especially trying to minimize the amount of individuals that are exposed or the limitations that are happening with PPE, personal protective equipment. So again, thinking outside of the box is what you should be doing. And thank you for giving these really concrete examples of what students should be thinking about. And you actually mentioned this in part of your answer, talking about some institutions being virtual while others are not. And it's interesting because you think about how some institutions may have limited courses, thus impacting students' ability to take a course in the fall semester versus the spring semester. And it may be a prerequisite course. And students, as we talked about in our pre-work for this, medical students, pre-meds, they love to stick to timelines and like to have everything planned out. And now they're not able to do so. When you're talking to students now, what would you recommend students do when they're looking at the transcripts and trying to figure out what's the next step to do?
Yeah, absolutely. So one of the things that I try to remind all students, because right now a lot of my appointments and my conversations with students are centering around, this is not how I expected it to go. Everything is different. All my plans are out of the door. I mean, and the pandemic, if nothing else, has shown us that it is really entertained by someone's plans. It does not care what your plans are. It has its own thing and it's going to win. So you have to learn to be flexible. You have to learn to be okay with things may not necessarily go in the exact timeline that you want, because everything is up in the air right now. But don't forget, everyone else is going through the same thing. It's not just you going through the pandemic and having your plans upended. Everyone has had their plans upended, including the professional schools. They are also going through this. And if anyone knows what it's like to have your plans uprooted and everything changes, and especially if it's for a medical reason, it's going to be the people that do the medicine, the professional schools. So they understand how this changes things. So it's not to say that changing your plan means that you've given up. That's not what that means. Adjusting your plan and being able to pivot is a sought after skill that everyone is going to be looking for from here on out, because this showed everyone that you need to be able to adjust as quickly as possible and as successfully as possible. So being able to adjust your plan is a great thing. Does that mean that your timeline might extend? Sure. Is that a problem? Absolutely not. Above all else, your well-being is going to be more important than the timeline. And if you really feel like with how the modalities of classes changed, so it went from in-person to completely online and remote, and you can't even get to campus and you can't see, all of these different variables have made it so that this is just really stressful time for you. To be completely honest, I really need all of you to be physicians and healthcare professionals, because I'm going to need them soon. I'm getting up there. And I really know that you cannot do that if you have lost your mind because you took on too much during a pandemic. Okay. So really take your well-being into consideration with this. think about what is too much for you to handle. Like I said, everyone's situation is different, and everyone has a different amount that they can deal with in terms of trauma and what they have access to and things like that. So you really need to think about those things, and that the plan needs to change. It just needs to change. In terms of classes, that is a lot more complex because that depends on your school and policies at your schools. There's a lot of schools that have changed grading systems or allow students to change grading systems. So it's no longer a 0 point to a 4 point or a A to a F. You now have an option to do a pass fail or a pass fail plus or a no record COVID or credit, no credit for classes that never had that opportunity before. And for some of the schools, they have that, but you can also keep your grades on your transcript if you want to send them places later, or your grade just disappears. There's so many different ways that different schools are handling the pandemic and what it's doing with classes and students' ability to perform, that you really need to talk to your advisor. You need to talk to an expert on your school's policy to determine what's going to be the best way moving forward in terms of your grades, because that determines things like, can you repeat a class if you don't do so hot in it? Or if you take this grade, can you not repeat the class and you have to go to a different institution to be able to repeat it? If you decide to take a semester off because this is a lot, does this, like Dr. Alden said, does this throw off the trajectory because this class is only offered in fall and this one, the next one is only in spring? You really need to sit down and talk with an expert in your school to determine what's going to be the best path forward. There are different things that are happening across universities. There's a Big Ten Academic Alliance where participating schools will allow their students to take one class at a different Big Ten school for free. And some of those may be science classes that you can do if it's off sequence at your school. Are there other partnerships that your school has that are similar to that, where you could go someplace else to take a class that your school may not be offering in the same sequence because things are thrown off a little bit? But really, it's all going to start with talk with your advisor, because you need to have a full understanding of the policies and the pros and cons to be able to make an informed decision on how to move forward best, so that you are not backing yourself into a corner, or at least not know that you're backing yourself into a corner and have a plan to get out of it. So make sure that you're meeting with your advisor at your school so that you can determine those things and see if there are other avenues to take courses out of sequence, maybe not at your school, but at a neighboring school or something like that.
Thank you, Janae. And I just want to go back to two things that you said. One, centering on wellness, and thank you for focusing on that, because that's often not something we think about. And pre-med students often put a lot of pressure on themselves to stick to artificial timelines. And I know there's conversations already happening in the Q&A about what should non-traditional students do and so on and so forth. We're going to get to that and part of our later questions. But just understand that there's a strong likelihood that there's going to be more and more quote unquote non-traditional students because of COVID-19. And schools, medical schools, will specifically need to address how they view applications for students who are coming fresh out of college, to students who are impacted by college, to students who would fit the traditional definition of non-traditional students. So forgive me for stretching that out as much. And then secondly, just to double down on the point that you said, the importance of talking to those experts, those individuals at your campuses who should be there to have your advice, and making sure that you are engaged with your pre-health advisor and having a good relationship with them. And I know that can be a contentious point at times. However, I would like to say, for the purpose of this discussion, we're assuming that your pre-health advisor is going to be there to be supportive of you and help you to make the right decisions about choosing courses and how to best move forward. And so be sure to engage in those individuals early. Make sure you have an open line of communication. So thank you, Janae. I want to turn to you, Chris. I have a couple questions for you. So you're looking at this from a different perspective. Janae is coming at this from a pre-health advisor's perspective. You're on the other side of things, where you're on the admissions committee for our medical school. And there are more and more students applying to medical school. How are medical schools handling these increased number of applications to ensure that each applicant has a chance for a fair review, but more specifically, a holistic review?
Yeah, no, thanks, Alden, and thanks for inviting me on. And I just want to say, I wish I had a Janae when I was applying to medical school, because that information exactly. It's right on. So there's a couple of things, right? So The screening process, I think, is the place with all of the extra applicants that a lot of medical schools, and I can't speak for every, I can just talk about the experience that we've had. And so with that, you know, the medical school had more people involved in the screening process. And I'm going to talk about this technically to deal with the numbers, and then we'll talk a little bit about the holistic aspects that you're getting to. So the first part is getting through, you know, the screening, like who's going to be invited for an interview after you've done all the stuff that Janae said that you should do, after you really kind of put yourself out there. There are folks who don't know you, as she mentioned, there are strangers, and they're going to be screening your application to see, is this the person that we want to bring in and talk to them and see, or these days virtually, you know, interview them. And I would say that given the increase in numbers, we made sure that there are more people in the screening process. Also, the screening process is balanced. So it's not just one person in a room saying, I don't like this person. Actually, there are people in our process, there are multiple people involved, and there are people who if somebody feels strongly, they can overrule. So there might be somebody who speaks to, you know, this particular screener, and they can really see something, maybe it's non-traditional, maybe something else. And so trying to make sure that those other things get heard, and those folks who it's more than just about the numbers and the boxes that you checked off, and it's a culmination of your experiences. The other thing is, of course, during the process, and you know, I think all of us, because the pandemic affected all of us as individuals, worked extra hard when we did our interviews with folks to hear and think about, you know, not everybody's going to have these shadowing experiences, and, you know, really remembering that some of the tools that we were using before that we assumed everybody had, they're not going to have those. And I think it really was good for the admissions committees to stretch out and start thinking about some of the things that Janae said. People are doing really innovative, interesting things to help people. And I think they actually cracked the door open for some other folks who maybe, if everything was exactly the same, maybe they wouldn't have stood out the same way. They were the same person, but you get some opportunities to stand out as you do your volunteer work, as you're helping communities in different ways. And I feel that having those stories come through in the committee as we interviewed people, as we discussed people, really helped as well. And then lastly, I think, you know, we really, a lot of us, you know, myself, I can speak for myself in particular, really re-emphasizing over and over and over again that this is a different experience. This is a different time for folks. We want to think more. Some people haven't been able to take the MCATs, right? And, you know, really there was a lot of stuff where the numbers, which really I think, you know, have a very strong impact. They're just not, they weren't there to fall back on in many cases. I think it really made folks really look at the whole candidate in a different way than we did before. So I feel like the screening, you know, kind of practically the numbers for us, and we had extra people that were involved in the screening process. We actually tried to make sure with the interview, that's the other thing, there are people who were able to interview who couldn't before because they didn't have to pay for travel. I thought that was a really big thing, I think, as well. And I think understanding when somebody's coming and they're in a different time zone and they're sleepy, all these things, we really thought about all of those things to make sure that we're looking at folks all the way around. And I think in many ways, the pandemic forced a very rigid system to really think about things in a different way. Now, every school is different. I know that there's some schools, I mean, again, the numbers are higher. It's still very hard, and more numbers doesn't make it easier. But there is certainly an effort, certainly in our system, and I'm sure in many systems, to try to make sure that we're able to see those candidates and give people a chance to shine, and recognize in this space that there might be some folks who did some different things and who had different things that we didn't see before.
All right, great, thanks for that, Chris. And you're really helping us think about the complexities, both from the medical school side, because we often are so focused on the experiences that we're going through, and we don't think about the people on the other side. I know there's a lot of students, and Janae mentioned this earlier, so there's some students that decided to take the entire semester off because they didn't want to do virtual learning for a semester or for 2 semesters. How do you think this is going to impact their applications to medical school?
Yeah, so in this one, it's not the fact that people took a year off or semester off, is what did you do with the time? And, you know, you might say, well, I couldn't do anything, but as you heard Janae say, there are ways that people can volunteer or do things with the time. I think from the perspective of the reviewers, the narrative of who you are is really important. And so you want to be able to craft that narrative throughout your whole experience. So if you took time off, and or there was an experience that happened that interrupted your education, you weave that into your narrative about who you are. I think the thing I tell when I'm advising students, if they're going to take time off, what are you doing with the time? And maybe it's, you know, you again, how are you helping a community? How are you helping a community? How are you helping, you know, maybe it's family, extended family members, whatever it is that required you to take your time off. You really have to think long and hard about how you weave it into your narrative. And in that case, then this is not a you know, oh, you took time off, you're non-traditional. As you discussed, more and more of the students that we see are not traditional and have taken time off. I was a non-traditional student a billion years ago, and I look now and I feel like everybody is almost half the class, it seems to me, has done very different things. So I don't think the time off itself is a problem. I think what you do with that time is really important, and how you craft, and then the expression of what you do. You could do great things, but as Janae said, if you're not expressing it, then how do us strangers know that what you did? Sometimes people did great things, and there's some folks who don't, I don't want to toot my own horn. And no, you got to say what you did, and you have to express it in a way that says who you are. And I think that's the key, for at least for the time anyways.
Right. And, you know, I you mentioned this earlier when you were talking about the interviews and time zones and how this has impacted students. You know, medical schools did interviews and it was virtual. There were some pros and there were some cons to the experience. Students weren't actually able to be on campus to get to see the institutions, get to meet the students in person, but they were able to have different interactions with schools and with students. But then also it defrayed the cost of travel, which can be a barrier for a number of students. Going forward, do you think that this will be a trend for some medical schools, and will we adopt some changes that we made because of COVID sort of in the long term?
Yeah, I'm going to speak for me because I don't know what the general policy is going to be for everyone. But I think there's some aspects, right, that we found that you can do a virtual interview, right? It can be done. Alden, as you said, there are pluses and minuses here. I think every candidate knows their strengths, and it's, you know, doing a virtual interview is different. We could say it's harder because that's what we know, but it's different. And how you sell yourself and how you talk and how you interact across the screen is different. I also think that if you're a candidate that has magnetism when you come into a room and you're used to that, this could be a disadvantage for you. On the other hand, there are folks who, like you said, without the cost, you can see a lot more people. And in that sense, it's a little more egalitarian, and it's not about, oh, I can only drive to these places because I don't have the money to go. So I do think there might be some of that. I don't know when the scenarios would come for people who are very far distances away, but, you know, where before it was like, hey, if you can't come, maybe you can come in the next cycle. Maybe we'll start making some exceptions for folks, and keep some of that virtual. And of course, we don't know what the world's going to look like. We're hoping that things will look very different, you know, better in the fall as we come forward, but it's not going to be exactly what it was. So I believe there will still be some room for the virtual interviews. And I would say that the other thing I'd say about that is sometimes people are, you know, in this particular scenario going forward, I also found that the interviews were a little less formal sometimes on the, you know, looking at it virtually. And I think for a lot of folks, that's good. It's not great for everybody, but that was really good. And I think that also allowed people to relax a little, and some of the interviews seemed to go a little bit longer, and that's all anecdotal. But I do think there will be some aspect of that will continue.
Great. Yeah, you know, it's the answer is we will see, and we have to see how our country responds and what happens with numbers, and, you know, hopefully we are move past this and our country is in a better place. But I think there's so many what ifs that are still up in the air that schools don't want to be too committal one way or the other, because they want to be able to adapt to what's happening in our country. And then one last question, and I think this is a really important question too, because Janae talked about this earlier on with everybody being a part of this, everybody being impacted by the pandemic. As you think about your medical school, how has the school itself dealt with the pandemic? And you could talk about it from any perspective, whether it's your institution or the medical school itself, however you best feel you can answer that question.
Yeah, so, you know, this is to me, and you know, like you said, one of the most important things that, you know, we've been saying this a lot, is true, and how the pandemic changed everything. But it wasn't just the pandemic, right? I think the expression and the focus on structural racism and social justice is really important. And I say that because as I kind of pivot to your answer, I would say that How I've heard it said before is we in medicine, speaking as a practitioner too, and not just as an educator, talked around some of these issues for a long time. We would say, structural racism, or we say, we'll talk about the built environment, but we would say structural racism. And one of the things that after, especially, after the death of Floyd in particular, as a pivoting point, I think that this really social justice and the place of social justice in the role of medicine, it was much more acceptable. Not that it wasn't, but you guys know what I'm getting at. We could actually say it and talk about this in a different way. And that impacted not just the applicants, the students, and the faculty. And so I feel that there was more space for people who said, for applicants who said, this is the work I want to do, whether it's doing work on disparities or equity, or, specifically talking about experiences, all the way through their application. For, I think, the medical students, they were always at our institution, the medical students, and it's true everywhere, medical students are always, really trying to push forward and making sure they're pushing the faculty to think about things. And whether you're talking about gender or ableism, or you're talking about race and socioeconomic status issues, the students usually are some of the ones who are really pushing these. The tenor of these conversations really changed the activism of the student, I think pushed the activism of the faculty. And then I think in the other place, where I saw the differences is how we and the admissions committee talked about these stories. And I think, as we heard the impact of these stories and really pushed, I think it was able to give voice. Many times there are folks in the room, there's only a few folks who really know those non-traditional stories. And I think there was a little more space given to really pushing for that. So I would say that the students and the medical students themselves, I know that after the folks who their clinical time was impacted just like everyone else's. And I think that the training and how that went, I know that was frustrating for many of them who wanted to serve more. They had to find non-traditional ways to serve, and they couldn't really, they were derailed like everyone else, and how their training was impacted became a big deal for some. But that separate group were just saying, how can I help? And I want to help. So I think we really evolved a little bit to talk more about social issues, social justice specifically. I think also we got to see the mission part of medicine over the kind of driven profession part of medicine. I think that really spoke up a lot. And I think you could see like, wow, this is why we were all here to really do these things. So that I saw a seismic change in that. I hope some of that is sustained, because I think that's really important. It's what brought many of us to the profession in the first place.
Great, and you took that question and knocked it out of the park, so thank you for your answer, Chris. I want to turn to you, Francisco, now for some more questions that are probably more stemming towards recommendations from a pre-health advisor. For students that consider themselves non-traditional, we know that definition is ever expanding as to who is considered non-traditional. How should they be approaching this upcoming application season? Let's say they were going to be submitting their application this summer for medical school. How should our non-traditional students be approaching this application cycle?
That's a great question, Alden. And I think the question really applies to everybody. Is your application ready to go? This is not an application that you want to take lightly and just give it a shot. It is a very expensive application process. It's time consuming. The conversation hasn't talked a little bit about secondary applications, and we'll talk a little bit about how those fit into the picture too, because the professional programs want to see an application that's competitive. When they see something that's not competitive, they're wondering, why did you make this decision? And is there something in your application that can explain it? If there's something that can potentially explain it, working with an advisor, with mentors, to get a sense of, is that something that really can make up a weakness in application? But if it's not a full picture or a full competitive application, that's the time to pause and say, are there things that I can do to make this application go that extra mile? And saving that time is critical. The other component to think about is that when you label yourself non-traditional, that makes it seem like there's something that's the difference and something that's not as common. And as you mentioned, it's more common now that students take at minimum one or more. We call them bridge years. I don't call them gap years, because you're bridging out to your next thing. It's something that we're trying to get students to think about, is that this is a long-term trajectory. This is not a profession where you're going to go in and then a few years later decide this isn't going to work for me, I'm going to change industries. You're committing a lot of time and energy, and knowing that upfront early that this is where you eventually want to be, then it should give you some flexibility to say, okay, I'm planning for my future, not just for an acceptance. And what is it that I can add to the picture? There might be some strengths that you bring into your application as non-traditional. If you have extensive clinical experience, because again, during your bridge year, you did medical assistant or scribe work or even COVID screening nowadays, again, those are the things that gave you a unique insight to the world of medicine. And having those elements in your application while across the country shadowing got canceled, right? So again, there are things that individuals have done to continue the growth and learning about the world of medicine and their commitment and passion to a career in medicine. And I think that's really going to lead to the next important and final thing that I want to add that kind of complements some of the conversation that we had, is that it's not a checkbox approach. You can't really just go down the list and check everything off. We're going to encourage you all the way through the process to be reflective. Why did you learn? How did this help you grow? Not just your process of learning why you want to be a physician, but even how did this pandemic impact you? Everybody got impacted, and your ability to articulate how it uniquely impacted you and what was the growth and learning that came from that experience? How did that solidify something? So again, thinking about how your language, your own ability to articulate what this impact had on you can really take your application to the next level. If you really can't articulate those motivations, it's going to be time to really take a step back and then spend time reflecting in that process. And again, in the non-traditional applicant, sometimes it is because they're strengthening other pieces of their application, whether it is improving a GPA, retaking an MCAT. If it was a life decision, right, starting a family, or even having to take care of finances and paying off some undergrad loans before going into medical school, those are all things that make sense. And again, if you can articulate what your journey was, that's going to be the most important thing. It's not that it's a negative thing.
Great. Thank you for that. And I think it really helped to frame the discussion that we're talking about here. It's about sharing your story and really helping us to understand your path and your trajectory. Because, when we're looking at applications and we have lots of applications to review, things like that can sort of get lost. And really helping to, as you shape that narrative, helps us to better understand who you are, what you've done, but more importantly, where you're going. And I think that's a great segue into my next question, as far as who you are and then where you're going. Students right now are thinking about that personal statement. They're scrambling, trying to figure out the right words to put into their into the essay. Obviously, there's a lot of people that are going to be talking about the pandemic, whether it's a personal issue that they dealt with or a family member. It's going to be a common topic in personal statements. I guess my question really is, does it make sense for students to be talking about the pandemic as a part of their personal statement, or should they stay away from this topic?
I think it's an individual choice, in the sense that the way that this pandemic has impacted people is very different. Even here in my own professional world, in my family, the pandemic has torn through our community back at home. Just a very simple example, in the last 6 months, 2 of my great aunts have passed away due to COVID, just in the last 6 months, right? And so for me, if I was an applicant, I would have a legit reason to talk about the impact and understanding grief and understanding how it has changed the whole family structure, right? So the people that are leaders in our community sometimes are being taken down by this disease. And so along the way, what we need to think about is, how was it impactful? If it's something that anybody can talk about and say, yes, I wasn't able to get clinical experience because of COVID, it's like, that's going to be a common theme across everybody's statement. And then that's kind of also connects back to my previous kind of statement about secondary applications. You can address certain topics in your secondary applications, a challenge you've overcome, anything unique. And again, that's a place where you can be more strategic in your application and really focus your personal statement to focus on your motivations, to focus on how you tested things, the impact that these experiences somehow led into your decision making, right? You got to connect the dots for your admissions committee member reading your application. And if you're not connecting the dots in a way that are meaningful for you and genuine, then your personal statement might miss the mark. And so you can choose to add it as part of your application. I would probably say do not focus it entirely, because in essence, you're going to miss the mark on addressing the main question of what are your motivations for pursuing a career in medicine. And then in the secondary applications, you can actually research those in advance, already know which school is going to ask any open-ended questions. And actually, that was the strategy that many medical schools did. Instead of making it a bigger focus, they said, we're going to add a question in our secondary application to not make it a focus of the personal statement. Other schools said, we're not going to add any additional secondaries. They can address in the personal statement if they want to. If they can wait till their interview, etc. So again, it really is a personal decision of where they decide to talk it. But the personal statement does need to have a very unique focus of somehow conveying that you have a genuine interest and testing and understanding of why medicine, and more specifically, the role of the physician, right?
Thank you. And I remember hearing from you early and when I first met you about the importance of making sure that a personal statement is both personal and makes a statement. And I think that's what you're really driving home right here. So thank you for that. One last question. And I know we talked about this a little bit more, a little earlier with Janae. But again, going back to the student and timelines, pandemic, again, throwing off people's schedules. When you're advising your students, how do you go about advising those students to reassess their plans if necessary? And then, you know, if a student may not have someone that they feel comfortable with going to, who else should they be going to, and where should they be looking for advice?
Yeah, that's a great question. And again, the components that will be is, what is your support system? Janae did an excellent job just kind of highlighting that you have a support system that A is your foundation, might be family right off the bat. And if they don't have that experience in applying to medical school or the career in medicine, then definitely looking at experts and people who can do that. There is support. If there isn't a pre-health advisor at your institution, the National Association of Advisors for Health Professions, NAHP, does provide a free service that you can identify if there is a pre-health advisor at your institution. If there's no one there, then they are willing to work with you via email and help you kind of connect and help you navigate the process. But along the way, you know, there are current medical students at your institution. Are there any alumni that just got accepted that can help them through the process, helping at least understand the process a little bit better? But oftentimes it is going to be also evaluating consistently your application. Are all the pieces in place and ready to go? Because that's the component where COVID has thrown a wrench in everybody's plan. And we've had in other panels that I've been on, you know, deans of admissions are clearly saying, everybody got dealt lemons in this pandemic. How do you turn things around and make lemonade out of this situation for you, right? And for some of you, might have been simply changing your plan to saying, all right, I'm going to focus more on research because I can have a more critical impact right now this way. For others is, I do have to take some time off because I have to take care of family right now. And that's a legit reason. And being able to, again, piece things together through your application, so it weaves that understanding. And again, there's other support that you can gain, you know, just your writing ability, writing a strong personal statement, look at your communication centers, your writing centers, faculty that you've connected with. They may not know the whole application process, but there are things that they can assist with throughout the way in your application to make different pieces of it stronger, right? Just simply getting feedback on your personal statement can take it to the next level. Your letters of recommendation, we've talked a little bit about those briefly, but they're a piece that you really can't put a weight on it, but it's clearly that those letters are more powerful after the interview, because MCAT and GPA just kind of fade off into if a school has already committed to interviewing you, the numbers in essence aren't a question anymore. And so now your letters, your actual interview itself, interview practice, again, there's a lot of pieces of breaking it down. If you don't have an advisor or a team, you can meal piece it and find out who is the best person in your community and your resources, and ask other people to connect you, right? So professors and mentors can connect you to other people that may know the information. Asking is going to be the way to go, and it's not the time to be shy. And that's going to be a quality of your skill that if you don't have as a future physician or healthcare provider, you know, that's a quality that right now you should be working on, being comfortable to ask for help. I want my doctor to be comfortable to ask for help. If he can't do it, then I want the next doctor that who's okay asking for help. So these are all skills that medical schools are looking for. Are you doing the competencies? And we've shared the competencies that the AMC has put together to talk about, you know, your letter writer should be able to write about it, but can you talk about those competencies, right? And that's the place where if your letter writers can talk about it, but you can't demonstrate in your application or can't talk about it in an interview, then the applications is not going to match. The person in the application is just not going to match. For medical school, makes it easy for them to go to the next person.
Great, thank you. And I just want to highlight something for the audience out there. If you listen, Francisco mentioned about the importance of strong mentors, having a relationship with your pre-health advisor. At no point did he say go to a Reddit website or to go to other websites that may have information about applying to medical school. So just to put that out there, there's information and then there's misinformation. I think our country is unfortunately suffering from a lot of misinformation. And I think that Francisco was trying to point you in the direction of trusted sources that will be able to support you and not provide misinformation. So that you may not have said that as directly, Francisco, but I just wanted to double down on that because I think it's important to be said.
Well, and I just want to jump in and say one last thing. You know, if we weren't talking, you know, about the reality of diversity and importance in medicine, you know, it's very clear that underrepresented communities don't have the resources, don't have the opportunities to have doctors and physicians as part of their communities or in their families. And so by clearly acknowledging that, and the more a medical school can be transparent that they recognize that, then that's going to give you an indicator, are you a good fit for that program? Because as you go through this process, you're also evaluating them.
Yeah.
How are they going to provide me mentorship? How are they going to provide me academic support? How are they going to help me in my clinical training? And at one point, it has to be a two-way street. When you understand why you select and apply to certain medical school, you have to be able to articulate why that unique school has something that fits you as well. And mentorship is one of those things that if they're not providing mentorship and you don't have those resources, how is that going to be related to when you apply to residency or when you prepare interviews for residency and prepare for your board exams? Again, it's a support network that you're trying to find and be comfortable building that support network no matter where you go.
Great, thank you. And I just want to before we move to our next panel, say thank you to all the panelists as they're in the middle of this panel looking through the Q&A and answering as many questions as possible. You know, we didn't pay you a lot for being here, i.e. zero, but you're doubling down and doing twice as much work. So I really appreciate the fact that you're not only answering questions for the audience as a whole, but also answering these questions. I appreciate that. And I just also want to acknowledge Chris De La Cerda, who is representing the Office for Recruitment and Multicultural Affairs at Harvard Medical School, who is also answering questions for us as we go through this panel. So thank you, Chris, for being a part and answering as many questions for us as you can on behalf of the ORMA office at Harvard Medical School. I last want to go to Dr. Nakae and to bring you into this conversation and have a little bit more of a talk around some of the things that Dr. Lathan was mentioning. So in addition to COVID-19, we've had this social justice movement and it's still ongoing, and many students are involved in the wave of efforts related to social justice. Do you advise students to include this as part of their application to medical school? And I guess more specifically, if they do include this, how should they do it?
Yes, I think it's a great question, and I get it a lot. There's a lot of students wondering, is this, you know, is medicine too conservative? You know, can they handle the activism that I'm bringing to the table? And I would hope that we can, and I would say bring it and be your authentic self. If you've engaged and you're working in community, that like Janae was talking about, like that shows that you care about things outside yourself. That is something that obviously is related to equity, but not necessarily the healthcare check the box kind of thing, right? You got up out of your comfort zone and are working with community. I think the way to include it is, there's a lot of ways. You could put something about it in your personal statement. If there's important learnings or realizations that you've had that you want to put there, if it ties into your passion for medicine, you can include it as an experience. If you've been engaged with an organization, you could save it for supplemental applications, because a lot of times there would be specific questions on your supplementals related to recent learnings lately, or, you know, opportunities for growth, you know, failure, that kind of stuff. So you can also kind of tailor your supplementals a little bit more. I think this is a school that would really appreciate, or has more out there in terms of its curriculum and learning opportunities that would match up with what I'm doing in terms of activism. And just like Francisco said, you know, you're vetting these schools as well. And so if Black Lives Matter is important to you and is something that you support, do you want to go to a school that doesn't support that? I mean, and it's just, obviously as a pre-med, it's just like, I just want to go anywhere, just let me in anywhere, right? But you do have to be there for 4 years. This is the beginning of your career. These are your lifelong colleagues. And so do think really carefully about a school's response to those things and how much they're meeting some of the demands that I hope that our students and pre-med students continue to place on us for, becoming anti-racist, uncovering a lot of the oppression that exists in medicine, the foundations of oppression in medicine that we need to change. And so I certainly don't think that you have to scrub it out of your application and try and be something you're not. I always say your authentic self is the best person to put forward as a candidate.
100% agree. And I think as Chris was alluding to this in his part of the conversation, we're thinking about these issues entirely differently than we did before. And so if you're confident about the work that you've done and you think it is meaningful and has helped to shape you as an individual and you think it's going to shape your career, remember, we're looking at where you've been, who you are, and where you're going. And if this is a part of that journey on where you're going, I think it's important for you to think about how you can best include this. It's interesting. We're getting a lot of questions from students, and they're focusing on MCAT and GPA, MCAT, GPA, as if those are the only things that matter. And to a degree, they are important. However, some schools transitioned to MCAT optional this year, while others continue to stick to their traditional approaches of and how they use the MCAT, however that may be. Are there any trends that you see related to the MCAT? And the reason why I asked this question is, in medical school, we've taken one of our major board exams to pass fail. And so residency programs are now having to think about the USMLE differently. But how are medical schools approaching MCAT, whether it's pass fail or other ways?
Yeah, well, so remember the MCAT we have now just came out in 2015. So there's a lot of long-term data that's still pretty new, and schools are sort of discovering if they can rely on section scores or how it works within their curriculum and what their thresholds are. I am pushing always on the inside at AMC and in my leadership positions for greater transparency around the MCAT. I don't really care how school X, Y, or Z uses it. I just think that they need to be straight with applicants about how they do. If my file is going into the shredder instantly, then just save me the money and I won't apply, right? So I really think we need more transparency in how it's used. Some schools may move forward into using it in more of a pass-fail manner. The pass-fail might not be the same. The pass threshold might not be the same at every school, but I'm definitely pushing for more holistic tools sort of built in and more transparency, because I think this will help applicants apply more strategically, get more for their time and more for their hard-earned money that they have to put forward just to sort of attempt, to get an interview to medical school. So I think the MCAT, I saw a lot of questions about the MCAT as well. And let's just, I put this in my book too, like, don't miss the head fake with the MCAT, right? There are licensing exams down the road that you need to be able to tackle. And those test taking skills and academic skills are important. Now, do you need a high MCAT score to prove that you have those skills? No, but you do need those skills. So we want to make sure that as we talk about different ways of using the MCAT, that we don't miss the test prep part, because that is a core aspect of your preparation. You're going to be a lot happier in medical school and beyond if you're just comfortable with your ability to take a body of knowledge, study it, and translate that into proving that you know it on a standardized exam, because licensing is not going away anytime soon. So even if the MCAT were to poof, magically, vanish, it would still need the test taking skills in order to pass those block exams in medical school and your licensing as well.
Yeah, I 100% agree. And honestly, I think that it's really important not just to it's not about doing well on the MCAT. It's understanding that exams will be a part of your life once you enter into the health professions. And the reality is, I'm going to start studying for my recertification to remain board certified in emergency medicine. And it's been a long time since I took a standardized test, but I'm going to harken back on some of those skills that we talk about on the tour for diversity on how to prepare for a standardized exam. And I think, that's really what's important. And there's a reason why those types of exams are important, because we want to make sure that people are competent and capable when they're providing care for patients and they're up to date on the information. One last question for you, Sunny. Do you have any recommendations for students to continue to improve their application for medical school, knowing that, again, shadowing opportunities are limited, research opportunities are scarce, and even a lot of summer programs such as the Summer Health Professions Education Program have gone virtual?
Yeah, I think the other panelists have given a lot of great ideas about figuring out what you can do to make a difference. What do you care about and what are your gifts? And how do you use those things to improve the lives of people around you? And truly that's at the heart of medicine, right? And so how to be other oriented and service oriented. So I would say in your own community, try and identify needs, things that are happening. You could potentially tutor online. You could read to people. You could work at you could volunteer at a memory care center, just, being on video and reading books or doing music. If you have a talent for sports, think about ways that you could connect in sporting communities that might be in socially distant ways or online. If we are determined to give and to give back, there are ways to do that. And so if that's your goal, then I would really focus on what's in front of you, things that you can do within your own community. And often I think students really are stuck in this. They want like receipts and kind of endorsement. So if I do this and this is good for my application, right? If I do this, this, and this, and this, then I'm going to get in, right? And this is okay. Worry less about that, because again, we want to shift your focus from what do I need to do to get in and meet all these requirements to what kind of person do I need to be ready to be someone's doctor? Right? And ideally those things should line up. They should be a really nice, concentric circle, but there are some requirements that are less about being ready to be someone's doctor and more about sort of jumping through those hoops that schools ask you to jump through. So really consider for you, what kind of a difference do you want to see in the world? And focus on engagement that's truly authentic from where you are, and get outside of the checkbox mindset. It's another thing that I like to really talk about a lot with pre-med preparation is focusing on how to give and not thinking about, well, it has to be shadowing, or it has to be healthcare, or I have to be an EMT, or I have to be a scribe. There's a lot of really wonderful ways to get engaged and make other folks' lives better that admissions committees would certainly appreciate reading your narratives about down the road.
Great, thank you. And we're going to make a small pivot now to try and answer some of the questions from the audience. There's already been a lot of conversation that's been happening in the background, and we're going to try and pick through some of the questions that haven't been answered, but then also really bump up some of the questions that have been answered. And so actually I want to stay with you, Sunny, for this first question. As students are making this transition, they may be finishing up their undergraduate career, and they're on the fence as to applying now versus choosing a post-bac. If a student is going to go the direction of doing a post-baccalaureate program, how do students know if it's a good program and what they should be looking for those experiences to help them, as they continue on their path to becoming a physician?
Yeah, that's a great question. So the first step is really self-assessment. Why are you doing a post-bac? Were you an underperformer, but you feel like you know your stuff, so you just need to show improved performance? Or were you an underperformer because you didn't have a chance to really learn those things? What are the reasons for your underperformance, right? Did you underperform because you had too much on your plate? You got too busy? You had to work? So figure out if you need academic enhancement, and then if that's the case, then why? What are the root causes? Because the last thing you want to do is say, well, I underperformed in undergrad because I had too much on my plate and I worked full time. Now I'm going to sign up for a post-bac program and I'm still going to work full time. It's not going to solve the problem how you got there in the first place. So do your own self-assessment and recognize why am I considering a post-bac program, and what things in my application or my candidacy preparation do I need to improve? And then there's post-bac programs sort of come in all spectrum, right? From do your own at either community college or continuing studies type programs, or just enrolling as a non-degree seeking student, all the way to highly structured, involving test preparation and professional development and mentorship and shadowing and all of that. So do you need other elements as well? Do you want test prep to be part of it? Do you want to be in a cohort of learners? Is a learning community important to you? There is a database of post-baccalaureate opportunities. It doesn't include all of them. It includes many of them around the country, and it's sponsored by AAMC. I think we can look it up and probably put it in the chat, but it will tell you whether it grants you a degree or certificate. That's important for two reasons. One, if you decide to stop out after your certificate, it's not a degree, right? So it has less earning power on the job market. And two, the financial aid is very different. So if you're a degree seeking student, you potentially can get additional financial aid, versus if it's a post-bac program, there's a limited amount of financial aid that you can sometimes get for the courses, but not for the cost of living. and talk to students that are in that program. Really do your homework before you apply. Were you happy with this program? Can I ask them, can I contact some graduates? What percentage of your students go on to apply to and successfully get into medical school? If you want application support as part of your post-bac experience, does that program have it? So self-assessment, what your needs are, and investigate the programs and what they come into, what they'll offer you, and then think about what fits the best and then apply. And, there's really nothing wrong with assessing on what's on your plate. I've worked with a lot of students that just said, I can't afford a full-time program. All right, then let's make a plan. Let's figure out how to take these courses, make sure that we use our time budget carefully so that you're not overloaded, so you can really show how to perform. And a lot of students do a do-it-yourself kind of post-bac experience, or will improve and do that until they say, okay, I've really proven to myself that I can do this. Now I'm ready to apply to a full-time, even master's program that I'm going to do before medical school. So one foot in front of the other, but I think that self-assessment of why it's needed in the first place is the most important thing to start with when considering post-bac opportunities.
Thank you. And I want to go to you next, Janae. So there's more people applying to medical school this year. That means that there's going to be more people who unfortunately don't get accepted to medical school. But there's going to be people who are going to stick with it and reapply. Any recommendations for people as to, they were in last year's application cycle, they got rejected. They're putting together an application for this year, or maybe they're going to hold off a year or two and then reapply. How should they go about reassessing their application? Who should they be reaching out to? What type of work should they be doing in order to put themselves in a better position to more likely be accepted next application cycle?
Yeah, sure. So remember your team. You got to go back to your team. Those people that wrote letters for you, they put a lot of time and effort into that. I know it seems very simple to be like, can you write me a letter? And someone does it and you think it was just done in 5 minutes and it's great. There's a lot of time and effort that goes into that. It's just a lot of pressure to write a letter for someone that wants to be a physician, someone that one day you may look up an emergency and it's the person that has your life in their hands. Yeah, that takes a lot of effort, and that person wants to continue to be involved. So if there's a situation where you didn't get accepted, yes, you let your letter writers know. They can look over some things. They're definitely going to want to write some additional letters if you're going to reapply, because you need updated letters. Your letter should always be dated within the calendar year of your applying. And you think of it this way: if you were accepting applications to be the partner in your life, do you want someone to give a letter of rec from 5 years ago? Nothing has happened in 5 years. No one can attest to what you've been doing in 5 years. You just giving me a letter from 5 years ago. No, you want to have a letter that is current. You also should have been doing some things. So while a lot of your application may remain the same because you're just adding on to it, there should be some additional things that you've added on because you've done something over the last year or 2 or 3 or 4. And so there should be additional things to add on. Your personal statements should be different. Again, do you want someone to just give you the same personal statement to apply to be your partner for life? Or do you want them to kind of rethink things and consider what could have been lacking? You want someone to put some more effort into it. So rewriting and restructuring your personal statement is going to be good. But one of the things that I recommend, if at all possible, because not all professional schools do this, not all med schools do this, but talk with the schools that are your top choices that you got rejected from. Med schools are like people. They all have different things that they want and different things that they are focused on. And you want to know from the ones that you are the most interested in, the one you want to, the med school you want to date the most, what were you lacking? What do they want to see improved? What was it? Was it just that you applied late? You need to apply earlier? Cool. You don't need to go and spend a bunch of money on a post back then. You want to make sure that you're getting some type of directed action so that you aren't just grabbing at straws and spending time and energy going in the wrong direction. Okay. So having some semblance of which direction to go to do improvements is going to be good. But if you are looking at schools that don't necessarily do that, because not all do, talking with your team, that's where you want to go. Talk with your pre-health advisor. What do you feel like I was lacking? Or if they told you at the beginning, you just said, I'm doing it anyway, you can still go back to them and say, hey, you were right about some things, possibly. Let's talk about how I can improve. So that you can have a better application the next time. So really looking back at the schools that you're most interested in, and then talking with your team and your pre-health advisor are going to be the best way to go.
you know, Janae always comes with the real world examples as she tries to relate. So thank you for the application advice, Janae. I want to go to you, Francisco, because I have a question about this. You talked about this earlier about students getting to know schools and doing research to the institutions that they're applying. How do students go about doing this? You know, everybody has wonderful websites and they have IT teams that are investing in putting up great information. But how do students really get to know the institution, especially from afar when we can't be there in person and be on campus?
That's an excellent question. You have to understand that each institution does have a mission and it really drives what they're trying to do and what motivates their funding, what motivates their focus on their curriculum, what motivates them to even set up shop at certain locations, even within their state. In the state of Georgia, there are private institutions, private medical schools that only accept in-state. And so if you're out of state of Georgia, you don't want to be applying to a school that doesn't take folks out of there. So there is a strategy piece as well. To be thinking about where is your application competitive, where do you have the best shot at interviews. So the #1 tool is the medical school admissions requirements, the MSAR. That's going to give you the latest profile by specific medical school for the last class that they accepted. You can see a range of GPAs, a range of MCATs. If your numbers are really falling into their profile, that's going to give you a heads up that it's going to be very tough to just even get an interview. And so that's really one criteria to be thinking about. But then you really got to start digging in deep. When you look at the mission statement, the curriculum structure, or even understanding what kind of communities are building, there is a support network there. And is it going to be the place where you feel you're going to thrive and succeed as well? So once you start finding where your application can be competitive, then you're also looking at, back to the dating analogy, you're going to be with this school for 4 years. Are you going to be happy with them just as you're hoping that they're going to be happy with you? And so as you're looking at schools, look at the students. Where do they hang out? What do they do? Look at the list of their clubs. A really good example. Is there a Black Lives Matter club that's already, or initiative that's already started there? So again, finding the pieces that highlight. On the flip side, the medical schools are doing the exact same thing with your application. When you think about secondary applications, they're really getting a chance to see what is your philosophy, what are your values, and how do you fit them? Because again, they're also trying to figure out if you're a good fit for them. So again, the numbers are there to kind of get your foot in the door, to be on the table, to be considered, to be brought in for an interview. But then all the other pieces is really your work to be able to show that connection of how you feel and bring something unique. And that's the other thing that I want to highlight is that oftentimes we're so focused on how do we fit a school or how does the school fit us, but what do we bring to the picture? Your diversity is something that is of value, and missing out the opportunity to talk about what is it that you bring to their class, not just your leadership qualities, not just your extensive research, but your style, your the way that you interact with others. If you're a collaborative person, if you have unique experiences that can highlight your ability to teach others, right? If you're working at a small problem-based, case-based learning curricula, be able to talk about your having that experience working in small groups consistently and making that connection of why their school is a good fit. That's going to go a long way in a secondary application because medical schools are looking closely. They have selected the questions that are important to them. Some schools have 3, some schools have 12. That says a lot about the schools that have 12 questions, right? And I've had students say, oh, this school has 12 questions, I don't want to apply to that school. It's like, well, that says a lot about the applicant as well, right? And so if you're not, if the schools are making you do a lot of work for secondaries, that says a lot about their culture and they really want to get to know you. They're giving you these open nuggets and opportunities to talk more about you, and skipping out on those questions can really impact your application. So that's the one component you want to be thinking about in this process is that not only can you stay competitive, can you bring something to the picture, but what's going to be a good fit at the end of the day.
Great. And I want to turn to you, Chris, because I have a question about students who may be looking at medical schools, but they're looking at dual degree programs, whether it's an MD, PhD, or they're looking to get a Master in Public Health or a business degree. How should those students be thinking about their application in med school, and how should they be assessing the programs that are out there as well?
Yeah, so I'm going to separate the MD, PhD from those other ones, right? Because I think if, what I always ask the MD, PhD candidates is, Why do you feel like you need both degrees? So people like research, and especially at an institution like ours, there's a lot of researchers. So I always want to make sure, why they're doing that. And if they can give me a good reason, that really fits with that narrative that you heard everybody talk about, then it makes sense. It's very competitive, obviously, because MD PhD programs, usually that changes your calculus for how much you have to pay for medical school. That's a very different situation. I do have and so I would say if you're a very strong researcher, and by strong, and of course it depends on which school you're applying to. I mean, you love being in the lab and you really want to be a translational researcher. These are the questions like I would push people on. Do you want to be a translational researcher? You want to spend, X amount of time, in your lab, and then also seeing patients and being able to have a narrative. That's really important. And the research will speak for itself. Those are kind of evaluated as separate tracks. But I want to spend a little more time on the MD and PH and MD MBA program. So you will pay more for those, right? And so there's always a question, I say, if the MPH is important to you. So for example, I got an MPH, but there are opportunities to get that where maybe there are opportunities where you don't have to pay for it. And it's not just about paying, but you really think about there's sometimes fellowship programs or other training programs. And, I think it is important to be broad, and that's not the only chance that you will have to get that other degree. And people think, well, I want to go into my residency and be able to use it. Look, man, when you're in your residency, you're going to be working, you're not going to use it. As a matter of fact, a lot of my colleagues who got their MPHs in medical school, they not that you forget it, but they're tools that you don't remember. And then after your training is done and your fellowship, when you're ready to do it, you don't remember. And on the MBA, I would say, if you're thinking about an MD, MBA, health executive, maybe going, not thinking about practicing, perhaps it might be worthwhile at that point to think about getting them together. But if you're thinking about being a physician executive, then again, hopefully there are opportunities to get that later, and maybe even get some help paying for it. So I actually, when I advise folks and they ask me, do I have to get it right now? I say, I don't think you have to get those right now. You can get those later, and sometimes there are fellowship programs that pay for. I was very lucky. My fellowship program paid for my MPH. They talked to me about MBA. I said, I'm tapping out, too much school, no more MBA for me. But I do think there are opportunities to do that. And so remember, you're not locked in to get it, right when you apply to medical school.
Chris, I think we're advising from the same playbook, because that's almost a word for word exactly what I say to students. So you're spot on with that. Sunny, I have a question for you about intersectionality. Students are bringing multiple perspectives to the table, whether it's their sexual orientation and gender identity, or it is their race, ethnicity, or that they are first generation. And students are often concerned about presenting that as part of their application, and they may want to hold some pieces back compared to others. What are your thoughts around bringing your full self to the application? How should students go about that when they're thinking about applying to medical school?
Yeah, I really do hope that we can all be medical schools that value applicants bringing their whole selves to the table, but how you present your candidacy really matters. So you cannot give me the oppression Olympics and then just end there. The so what really matters, right? So I'm not going to let you into my school because life has been hard. I'm going to let you into my school because you're the right person for the job and you're prepared to do it. So you have to make that pivot in the identities or experiences that you choose to bring in. Is why does this matter, right? So these hardships have enabled me to have perspectives about something, insights about system, understand systemic change, systemic racism, understand nuances of linguistic differences or the immigration system. What are the reasons why we should want this in medicine, and how are you bringing it to the table? I do think that we have added preferred pronouns to the MCAS application in the last couple of years, and that's been helpful. We've actually created something other than just the gender identity binary on the application, so that's been helpful. In general, I think the diversity that students bring is viewed as a plus factor when it's presented authentically, and when you're able to, especially if you share experiences, really connect it to the so what of why is this important in medicine, and what are you bringing forward. So, and have other folks read your personal statement, right? Like, use the tools that are out there. I have a personal statement review rubric. You can have a stranger read your personal statement and give them this sort of score sheet. And what did they learn about you, right? And they might say, I learned that you really like hockey. And you're like, dang, that wasn't really what I was going for, right? But like you got so carried away and being excited about using this fun little analogy that you didn't end up back in medicine, right? So make sure that as you tell your story, that it relates to why is this, like, who am I and why am I pursuing medicine? What do I hope to bring? And really bring it back. I also think that you can, as I mentioned before, kind of stratify this a little bit. You might have a little bit more of a safe personal statement that goes out to every school. And then again, as Francisco said, some schools are going to ask you to write bajillions of essays about yourself and who you are. And they will give you a clue as to, you know, why they're asking these things and if they value them based on even the engagement in their supplemental application. So that might invite you to share more about yourself with specific schools and increase your candidacy that way.
Wonderful. And then lastly, I do have one question, and then I want to just do maybe a quick round robin with all the panelists. Francisco, you answered this question. There were some students talking about virtual shadowing. What are your thoughts on virtual shadowing? And if you can keep it brief so we can move to the last question.
Right now, any experience is good experience. Don't pay for it. That's the main thing, because if somebody's asking you for money, that's a red flag right off the bat, because medical schools are being flexible. They're saying if you can't get access to shadowing, it's not the end all. What else are you doing? And from my perspective, any chance to interact with healthcare professionals, actually interact with patients, is going to be a lot stronger than just a shadowing experience. So don't bank everything on just shadowing.
Wonderful, thank you. And just quickly, I'm going to bounce around the room. Maybe one small piece of advice that we haven't touched on from each of you for students. I will put Chris on the spot first. Chris, do you have one short piece of advice for students?
Know your strengths and weaknesses. And when you do that interview, do not be surprised that people are going to ask you about the areas of your application that aren't as strong. Be prepared for that.
Janae, one piece of advice.
I had put it in the chat already, but do not reduce yourself to a number. You are more than your GPA and an MCAT score. You are much more than that. So don't ever sit there and go, all you have to offer is that number. That's not all you have.
Sunny, one piece of advice.
Medicine belongs to you. As long as there have been bodies, there have been healers, and our people have been in this space. Even though you don't see us in the history books as much, this is our time, and we welcome you and want you to keep trying and encourage you on this path. And don't be afraid. There are a lot of people rooting for you, and we wish that we could convey to you how much our conversations and the work that we do is really committed to keeping the doors open and the path lit for all of you along the way. So keep it up.
And Francisco Caliente, one piece of advice.
Know your passions, be able to talk about them. Why do they motivate you? That's usually the piece that students struggle with, because they feel like they're not a unique applicant. And if you are an avid marathoner, if you are an avid photographer, these are all qualities of who you are that can highlight a little bit about your unique perspectives, your unique way of approaching life, that you have balance. And so don't underestimate the unique things that you do, because that does help you stand out in the application process and show that you're a human being, that you're well-rounded. It's not about fitting a profile. It's not about fitting a number, but rather who you are, and be able to articulate why those things drive you.
Great. And so before we go, I want to say thank you to our panelists. I want to say thank you to my friends, really, because these are 4 individuals who I've worked with over the years to join us here for this. So thank you all for being here and talking to students. For the students that are here, we have a very, very brief short survey that we want you to complete. And the reason why it's important for you to complete this is if you do, we're going to mail you for a few lucky students. We're going to do a raffle for a copy of Dr. Nakae's book. So please do the poll, and that way you're eligible for receiving the book. Secondly, there were about 75 open questions. Some were a little personal, others were very specific, and so it didn't necessarily fit within the framework of what we were trying to answer today. We actually answered 92 questions in addition to all the musings that I had with the panelists. We're going to try and tease these out a little bit more and put these questions somewhere where you can have access to this, especially for those questions we didn't get a chance to answer. So be on the lookout for that. We will post the questions, especially if there's something that's really generalizable that'll be useful for the rest of the audience. Thirdly, for this video will be closed captioned, and we will post it on the YouTube page for the Office for Diversity, Inclusion, and Community Partnership. So be on the lookout for that. We will be sure to put this up so you all can have access to it. There are tons of additional resources that we have available through our website, Harvard Medical School, and the Office for Recruitment and Multicultural Affairs, the Tour for Diversity, which is one of the co-sponsors for this event, as well as the Biomedical Sciences Career Program, which has some events that are coming up soon. And then lastly, we have a few other events that are going to be happening that you may be interested in hearing. We have some amazing presentations coming up in the few upcoming weeks. Check out the DICP, tons of other webinars, tons of other screenings that we're going to be doing, conversations that we're going to be having as we talk about equity and social justice in medicine. And with that, I want to say thank you to Chris De La Cerda, who's been in the background helping to answer questions, to Jasmine Stecker, who has been running the show for us, and to our amazing panelists, Francisco Castelan, Dr. Sunny Nakae, Janae Lawler, and Dr. Chris Lathan. Thank you for being here. Thank you for sharing this space with us. And to all the pre-med students, we look forward to reviewing your applications. And we can't wait till you join us as health professionals and on the front line addressing health disparities, fighting COVID, or whatever our battle may be next. Thank you for your time and have a good evening.